Substance use disorder. So when do we say that a person has become dependent on a substance or addicted to a substance? When is the patient dependent on a substance? When there is inability to regulate the use, which means the person has lost control over the substance use. You started drinking alcohol in parties, but now you just cannot control yourself. So how do we know that there is dependence? There are certain symptoms like tolerance. What is tolerance? Increased dose is required. Earlier you would drink 2 packs of alcohol and you would get drunk. Now you need 5 packs of alcohol to get drunk. You are very happy that your capacity is building up, but it is nothing to be proud of. You are developing tolerance. Withdrawal symptoms. You drink alcohol daily and in the morning you get up with tremors. You're feeling tremors, you're feeling anxious because the level of alcohol has dropped in the body, leading to withdrawal symptoms. Craving. Talab lagna. What is talab lagna? Strong urge to use a substance. So these are 3 important symptoms of dependence. There are 3 more, but these 3 are asked in the exams. This is perhaps the most common slide. Always asked in the exams. Alcohol withdrawal symptoms. Alcohol withdrawal symptoms. After 6 to 8 hours, the patient starts developing symptoms like tremors. Tremors are the most common alcohol withdrawal symptom, and other sympathetic symptoms like nausea, vomiting, anxiety, hypertension, dilatation of pupils. After 12 to 24 hours, patient can develop alcohol withdrawal perceptual disturbances. Like patient can develop illusions and hallucinations. This is rarely asked. This is asked. After 24 to 48 hours, alcohol withdrawal seizures, which are GTCS in nature, generalized tonic-clonic seizures, and they come in clusters. That is why also called as cluster seizures. So for example, you have one seizure, 10 minutes later second seizure, 10 minutes later third seizure. Alcohol withdrawal seizures, and after 48 to 72 hours, the most important complication, delirium tremens. Now, delirium tremens question, they will tell you 3 symptoms. What are the 3 main symptoms? Disturbances of consciousness. The examiner will say that patient presents with altered sensorium, or patient appears to be confused. Second symptom is disorientation. 2. Time, place, and person. And third symptom is perceptual disturbances, most commonly visual hallucinations. So if they give you history of a patient who has not consumed alcohol for 3 days, now appears to be confused, cannot identify family members, and is seeing animals all around him, diagnosis delirium tremens. ठीक है, ये आता ही आता है क्वेश्चन, हर बार आता है, मिस्टेक नहीं करना है. You can't get this question wrong. Treatment. So whenever you treat a substance, the first step is detoxification, in which you basically manage the withdrawal symptoms. Manage the withdrawal symptoms. कृष्णा कह रहा है सर 2 वाला प्लीज एक्सप्लेन. 2 वाला क्या है भाई? 2 वाला मतलब? कृष्णा भाई पहले यू एक्सप्लेन मी योर क्वेश्चन, फिर तो मैं एक्सप्लेन करूंगा कुछ. परसेप्चुअल, अच्छा ये वाला. Alcohol withdrawal perceptual disturbances means patient may start developing illusions and hallucinations. Alcohol withdrawal perceptual disturbance. आता नहीं एग्जाम में, आज तक तो नहीं आया। अगर अभी आ गया इस बार तो कृष्णा तुम्हें बहुत लोग दुआएं देंगे। 12 to 24 hours एल्कोहल विड्रॉल परसेप्चुअल डिस्टर्बेंसेस। चलिए, डिटॉक्सिफिकेशन इज मैनेजिंग द विड्रॉल सिम्टम। द ड्रग ऑफ चॉइस फॉर मैनेजिंग एल्कोहल विड्रॉल सिम्टम इज बेंजोडाइजेपिन। Classical question. Patient is in alcohol withdrawal, but there is liver damage. Which benzodiazepines would you prefer? Lorazepam and oxazepam. They have lesser half-lives, shorter half-lives, and they are also metabolized by glucuronidation rather than oxidation. Shorter T halves, and their metabolism is by conjugation. Glucuronidation. ठीक है. You also give thiamine to patients because you are afraid that patient may go into Wernicke's encephalopathy. And for delirium tremens also the treatment remains the same. ठीक है. Once your patient's withdrawal symptoms are managed, then you start the next step of treatment to prevent the patient to prevent the patient from going back to drinking. The withdrawal symptoms are over, but he should not relapse. This is called as maintenance of abstinence or relapse prevention. For this, what you can do, you can decrease the craving for alcohol. You can decrease the craving for alcohol by giving naltrexone and acamprosate. And the other option is you can make the patient scared of alcohol. How? By giving disulfiram. If the patient is taking disulfiram and on the top of it, if he drinks alcohol, he will have a very bad response called as disulfiram ethanol reaction, in which he will have palpitation, flushing of face, hypotension, arrhythmias. So patient becomes scared that I will not drink alcohol. This is called as deterrent approach. The better approach is anti-craving. You decrease the craving. You decrease the craving. ठीक है. Now, if somebody is using alcohol for too long a time, he may develop Wernicke's Korsakoff syndrome. They are basically amnestic disorders. What are amnestic disorders? In which the primary disturbance is in short-term memory. So Wernicke's encephalopathy, pet question of exam. It is the acute complication. Symptoms का mnemonic क्या है? What is the symptom mnemonic? Goa. G is global confusion. O is ophthalmoplegia. Ophthalmoplegia is caused primarily by the palsy of sixth nerve. And A से आता है अपना एटेक्सिया. गोवा. Cause vitamin B1 deficiency. Treatment high dose of parenteral thiamine. High dose of parenteral thiamine. This is the acute complication. Chronic complication is Korsakoff syndrome. Symptoms anterograde amnesia, more than retrograde amnesia. And यहीं पे we will remember that the side effect of ECT is reverse. In side effect of ECT, retrograde amnesia is more than anterograde amnesia. Retrograde amnesia is more than anterograde amnesia in ECT side effect. We can remember this and remember that ECT में उल्टा होता है. Another symptom is confabulation. What are confabulations? False stories made by patient to fill the memory gaps. False stories made by patient to fill the memory gaps. So Korsakoff psychosis, symptom anterograde amnesia more than retrograde amnesia, confabulation. Cause same, vitamin B1 deficiency. Treatment, long-term oral thiamine. Prognosis is not so good. Prognosis is not so good. ECT को लेकर कंफ्यूज मत होइए. आई एम जस्ट ट्राइंग टू हेल्प यू रिमेंबर अनदर पॉइंट. ECT के साइड इफेक्ट्स आर ऑल्सो एमनीजिया. सो साइड इफेक्ट ऑफ ECT इज अपोजिट ऑफ दिस पैटर्न. इसमें ECT देनी नहीं है, बस याद कराने के लिए कर रहा हूं, जस्ट टू हेल्प यू रिमेंबर. अच्छा, ECT क्या ये पूछ रहे हो? ECT इज इलेक्ट्रोकन्वर्सिव थेरेपी. ठीक है. Venkat is saying last slide, please. Venkat, here you go. Yes, Dad. It's about modified ECT. Direct ECT has been banned. Das is saying treatment of conversion disorder. वही साइकोथेरेपी. साइकोथेरेपी. चलो ठीक है. ठीक है, चलो आगे बढ़ते हैं. राइट. ओपियोइड्स. ओपियोइड्स के क्लासिकल क्वेश्चंस एग्जाम में आते हैं. ओवरडोसेज कैन कॉज डेथ. In the exam, please remember the moment you see this term, pinpoint pupil. Pinpoint pupil. Meiosis देखते ही you have to think towards opioid toxicity. Opioid toxicity. Pinpoint pupil, decreased respiratory rate and decreased hypotension. Heart rate भी नीचे, respiratory rate भी नीचे, hypotension. ठीक है. बट पिन पॉइंट प्यूपिल पढ़ते ही थिंक अबाउट ओपियोइड टॉक्सिसिटी. ओपियोइड टॉक्सिसिटी कैन बी लीदल because of respiratory depression. Because of respiratory depression. And the drug of choice for opioid overdosage is, सालों से क्वेश्चन आ रहा है, this question is being asked for years, intravenous naloxone. Intravenous naloxone. Cannabis, intoxication, dream-like state. Dream-like state एग्जाम में आता है. Dream-like state is seen with cannabis intoxication. Cannabis withdrawal presents with irritability and depressed mood. Cannabis withdrawal presents with irritability and depressed mood. ये याद रखना, cannabis and LSD can cause reflex hallucinations. What are reflex hallucinations? किसको याद है? Who remembers it? Stimulus in one modality causes hallucination in another modality. Stimulus in one modality causes hallucination in another modality. Patient comes and says, I can see the music. When I listen to music, I see circles, rectangles forming in front of my eyes. याद रखना, reflex hallucination, cannabis, LSD. Cocaine का क्वेश्चन क्या है? Cocaine bugs. Right? Tactile hallucinations that insects are crawling under the skin. Cocaine bugs, which are tactile hallucinations. And if they give you history that after taking a substance, the patient's BP is high, patient is aggressive, there is mydriasis, remember it could be cocaine. Cocaine causes sympathetic symptoms. Nicotine. So smoking, right? Nicotine एडिक्शन का निकोटिन रिप्लेसमेंट थेरेपी दे सकते हैं, लाइक निकोटिन गम्स, निकोटिन लोजेंजेस, निकोटिन स्प्रे, निकोटिन पैच. This question comes in the exam. If you're using nicotine gums for 15 minutes before and after, don't eat or drink. ठीक है, don't eat or drink. ये एग्जाम में आया था. Now the most likely question is going to be on Varenicline. Varenicline, very important. Varenicline mechanism of action क्या है? It's a partial agonist at alpha 4 B2 and alpha 7 nicotinic acetylcholine receptor. ठीक है, drug of choice for nicotine dependence syndrome. This is the question that comes in the exam. Best drug for nicotine dependence is Varenicline. Varenicline. Bupropion can be used, but this is what comes in the exam and what is the drug of choice. धनिया कह रहे हैं why? बेटा because the mechanism of action is such that ना it decreases the craving, it decreases the withdrawal symptoms, and if somebody smokes, he does not even enjoy it because receptors are blocked. So this is one drug that I have seen in my practice having a tremendously good effect on patients. नोबिता कह रहे हैं सर गम वाला. बेटा गम वाला ये है कि if you are using nicotine chewing gum, 15 minutes before using chewing gum and 15 minutes after using chewing gum, you don't eat or drink because the chewing gum releases the nicotine, it gets absorbed through the oral mucosa. So if you eat or drink, वो absorb नहीं हो पाता है. आकृति पूछ रही हैं, does it also work for tobacco eaters? You mean chewable tobacco, गुटखा type? Yes, it does work. It does work.